Should you consider having pelvic surgery or prolapse surgery if you have a diagnosis of pelvic organ prolapse? Hi, my name is Dr. Kaylee Simmerman, pelvic floor physical therapist, owner and founder of the Hope Doctors Pelvic Floor Physical Therapy. And I have been doing this for about a decade now. And pelvic organ prolapse is pretty much an advanced specialty that I have because I live with it myself. And once I got prolapse myself, I realized there was just a lot of misinformation out there, a lot of fear mongering, and then a lot of like shame around it too. And so it's something that we need to talk about because the answer is not as simple as you should have surgery or you should not. And so if you go into a provider and they diagnose you with pelvic organ prolapse and they automatically say you need to have surgery, I would challenge that and ask, what are my other options? Now, I have to also preface with saying I am a physical therapist first. And so I will always try all and recommend conservative measures before we go into surgery. Conservative measures are pelvic floor therapist also. Find a pelvic floor therapist that has advanced training in pelvic organ prolapse to help you make this decision. For example, I sit down with my clients and I go over their diagnosis. I go over all of the conservative options. And then I also will list out all of the surgeries that are a potential option for them if they choose that. And I will support them through whatever decision that they make because it is their choice as long as it's informed consent and informed education and they understand exactly what all of it means. So, first and foremost, there isn't just a simple answer of like this type of prolapse deserves surgery versus not. But one thing that I will say is if, let's say, you have never had a symptom before, and then you went and you worked out, and then you felt a pop and a lot of severe heaviness and pressure all of a sudden, and it's constant, meaning it doesn't go away with certain movements. It's from the morning to the evening. If it's just all the time and it's never progressing and never changing, and it happened suddenly, that is one situation where I'm like, it's possible that surgery is probably going to be the best option because it happened from a traumatic tear in the fascia that holds up the organs. And it's probably not something that's going to progressively kind of descend throughout the day, meaning exercise movement positions may not actually make a difference. So that's one case where I say that. The second case is quality of life is a big factor in deciding whether or not you want to have surgery or not. What I mean by that is if you come into my office and you are automatically more worried about seeing and feeling the bulge, also having a lot of those symptoms, and okay, and having all of those symptoms, if you're noticing that and you can't seem to manage that, and it's causing a lot of emotional distress, a lot of depression, a lot of anxiety, if your mental health is struggling, those are reasons too that we at least want to go through with the consult because pelvic therapy may take some time to work. You may not want to insert or remove a pessary every day. There may be other factors that we need to take into consideration when it's something that is completely weighing on your mind. Again, that is not to say that every prolapse case needs to have surgery. A lot of the prolapse cases, and I would actually probably challenge the majority, there's a conservative option for, whether that be pelvic floor therapy, whether that be a pessary. Those are some options that are more conservative and it doesn't require that surgery because you have to think with surgery too, as long as they give you the type of surgery, a good and well-trained pelvic floor therapist is going to be able to educate you on that and help you decide which one's the best, what it means, what your recovery will look like, and walk along that journey with you. But when it comes to, again, just making that decision, I know it's a hard decision and it sometimes has so many different like nuanced layers to it too, right? So most of us did not have prolapse from the beginning, and it's not something that we've been living with for a long time. Most of us, it comes up after childbirth, or it comes up after a lot of heavy lifting, or it's kind of like a progressive thing, right? And you'll notice it and maybe isn't severe, but it kind of gets worse and worse, or it doesn't change. Those are situations where it's time to take action on something. So if you're not seeing a pelvic therapist, I always recommend finding one. But again, call them and ask them, do you have expert and advanced level training in pelvic organ prolapse, pessary fittings, all of those things? They're important to see. A pessary fitting is really crucial. So I find that pessaries can actually be so impactful and effective, and there's a lot of evidence and research behind them. There's so many options depending on what type of prolapse you have, where it can truly benefit you and improve your quality of life, which therefore will improve your mental health, but you won't feel the symptoms, which is such a big deal. And so a pessary can be really helpful, and that's what I do for myself is I use it when I need to. It doesn't have to be every day unless you absolutely need that every day. There are a few reasons why a pessary may not be the reason or the best option for you, though. And so, again, like if we don't have good mobility in our hands, or if we have a lot of trauma history and we can't remove things from the vaginal canal due to fear, trauma, anything like that, sensitive tissues, so menopause, sometimes it's not the best time frame to be able to insert and remove an object. If you have mesh, we don't want to use a pessary. And there's just some other reasons why that might not be the recommended next step. But what I always tell clients is I always think about it this way: come into pelvic therapy. It's not going to make anything worse. It's going to benefit you. And then you'll get an idea of what those next steps need to be. After pelvic therapy or during pelvic therapy, hopefully you try a pessary. And then that's when, if nothing changes within that time frame of your plan of care and you've tried a pessary, it might be time to consider. So, for example, I'm 4 years postpartum. I started noticing prolapse symptoms pretty immediate after birth. I knew what it was. I knew how it would progress. It did get worse there for a little while before it got better, but I'm so glad that I didn't make that decision too soon. I waited until I did a full plan of care. I continued working on it, exercising, working on mindfulness, working on the mental health aspect of it. And then I got a pessary at 2 years, and I wish I would have done it sooner. But after I used the pessary consistently for a while, I've noticed significant improvement. So, there are so many other options out there versus just surgery. And so this video is not going into the details of each surgery because that's so dependent on the person. They have different ones for like a bladder prolapse versus a rectocele or a rectal prolapse versus a uterine and apical prolapse. There's different types of surgeries for each of those, but it's just to bring awareness that it's okay if that's the decision that you decide to make, and that it is a decision that needs to be considered if your quality of life is completely demolished or diminished because of prolapse. Because sometimes pelvic therapists, physical therapists specifically, will just completely ignore that factor because we can prevent things. We don't want you to have surgery. We don't want to do XYZ. Let's move. Let's do this. Let's do XYZ. But we're not thinking about the mental aspect of it. And as someone who's lived with it, I understand that decision, and it's scary and overwhelming. And sometimes it's necessary. So, if you have any specific questions, great time to book a consult. I would love to chat with you. I do it from all over the world for pelvic organ prolapse to consider your subjective history, what happened. We can kind of talk about all of those options that you have and find you resources locally. But yeah, reach out if you have any questions, and hopefully you all have a fantastic rest of your day.